Hello and welcome to Chapter 1. This is our first chapter in Pathophysiology. As it states, we'll be talking about the introduction and we'll be talking about some basic concepts to pathophysiology. Here are our learning objectives. First, we'll explain the role of pathophysiology in the diagnosis and treatment of disease. We'll also use terminology that's appropriate for pathophysiology. We'll explain the importance of the patient's medical history as it relates to pathophysiology, and we'll also discuss some common cellular adaptations and possible reasons for the occurrence of those cellular adaptations. We'll look at precancerous cellular changes, and we'll also discuss the common causes of cell damage. Finally, we'll discuss the different types of cell necrosis and possible outcomes. Pathophysiology is a very broad subject, and in fact, it involves several disciplines of science. So it involves microbiology, it involves pathology, it involves anatomy and physiology, it involves all these different broad concepts, but ultimately, pathophysiology brings in those different subsets, and it ultimately decides what is the functional or physiological change that results from a disease process. So what this means is that pathophysiology oftentimes talks about what's wrong with the body instead of what is right with the body, as anatomy and physiology likes to talk about. It also deals with disease development and those associated changes that tells us that something is wrong with the body. Pathophysiology is very broad, and you'll need different concepts in order to understand the subject as a whole. So before we get into what is wrong with the body, we should know a little bit about what is right. And again, this echoes in the anatomy and physiology science, but ultimately what anatomy and physiology talks about is homeostasis. As a reminder, homeostasis is the maintenance of a relatively stable internal environment regardless of what the external changes are. So what this is talking about is regardless of the outside changes in our environment, our bodies should internally remain balanced or stable. Most times, if this homeostasis is maintained, then we have good health. We don't see disease processes. We don't have illness. But if this homeostatic environment is not maintained, then disease may develop. Health and disease are opposites of each other. So what I like to talk about in health is, what does that include? Well, it does include physical well-being, mental well-being, social well-being. And as we know, if any one of these areas are off, then illness can pursue. We do have social illness, we do have mental illness, and of course we have physical illness. So health is a state of balance in all three of these areas, whereas when we have disease, we have this deviation from our normal state of homeostasis or balance. We have physical impairments, we have mental instability, and we can also have social instability. And in some cases, if one of these areas are off or we are affected, then you do see illness pursue in the other areas of mental, social, physical. So it's good to know that all of these areas work in tandem with each other. Now, again, we often talk about physical impairments or physical disease, but there are areas where we have mental disease, and that can be affected with our social life and things. So just know that all of these areas must be balanced as well in order for us to maintain good health. When we talk about pathophysiology, we need a baseline, or we need values that help us determine if we are homeostatic or not. If we are not homeostatic, then that tells us that there is some sort of pathophysiological process going on. So a way that we tell that in a medical profession is through several indicators, and we do call these our health indicators. Those health indicators include our vital signs, our physical assessment, and lab values. Again, these all help us see if we're within a homeostatic range or not. Now, there is a nuance to this, that sometimes there are variables that can change this, such as our age, gender, genetics. Sometimes our environment and activity level can also have an effect on our vital signs, physical assessment, lab values. But the thing is that we should maintain a general sense of the range. So if you have little off values, that's okay. But when it's persistent and it's paired with an abnormal physical assessment, and then you have abnormal vital signs, and then you have abnormal lab values, then that tells us again that there's some sort of pathophysiological process going on. And another thing to note is that our normal values can vary based on technology, equipment, and even the health indicators that I just listed. So again, we do look at all of these variables when we talk about pathophysiological processes and disease process. Not only do we discuss what our health indicators are, there are different ways that we can help promote health. And these are things that you as the nurse would want to help encourage with your clients that you see in your medical field. So you do have 7 steps to health that I want to highlight. You want to highlight being a non-smoker and avoiding secondhand smoke. You want to encourage good nutrition, so that's eating 5 to 10 servings of fresh vegetables and fruit, high fiber diet, low fat foods, and limiting alcohol intake. You want to encourage physical activity on a regular basis, protection from the sun, making sure that your clients follow or at least are aware of cancer screening guidelines. Encourage them to have frequent doctor's visits or annual doctor visits and dentist visits to identify if there's any changes in their health, dental health, or physical health. And you also want to help encourage them with safety guidelines for home, work, and even when they're storing or disposing of hazardous materials. The reasons why they have these as a cluster is that most oftentimes disease can start from these several areas. So non-smoking or being a non-smoker, that helps protect your lung health. Eating good vegetables or having a good nutritional regimen, that helps with your metabolism, that helps with you getting nutrition, that helps with healing. So encouraging a good diet will help with the healing of disease process. Physical activity helps prevent issues with blood pressure, heart rate, or if there are pre-existing issues, you can help curb the effects of that with physical activity. Protection from the sun helps with preventing of cancer, along with following cancer screening guidelines. Visiting your doctor and dentist helps you see if you have any new processes that need to be investigated. And of course, when you're at home and work, you want to prevent occupational hazards. So tripping and falling would be one of those things. Even if they're lifting, if they're a client that does a lot of heavy lifting, you want to make sure that they're practicing good ergonomics or lift tactics, because these are some of the things that can break bones, or it can cause significant back injury, or even disposing of hazardous materials, because if that gets on the skin or in the eyes, you can also pose an issue with cancer or harming your skin cells. So again, these 7 steps to health, they seem very small, but they also kind of encompass where the start of disease can happen if not encouraged. Here are other areas of disease prevention, and I like to take a segue to talk about primary prevention, secondary prevention, and tertiary prevention. So when we talk about primary prevention, this is the protection from developing a disease. So again, this is kind of like your prophylaxis, or you don't want disease to start. So again, this highlights the good nutrition or regular exercise, limiting alcohol, not using tobacco products. You want to discuss helmet and seatbelt use, or even regular screening tests and exams to monitor risk factors for illness. You also want to encourage in primary prevention immunizations against infectious diseases, and also controlling potential hazards at home and in the workplace. Now, when we get into secondary prevention, this happens after an illness or a risk factor has already been identified. So you want to slow the progress of what has already happened. So that means that you want to make sure the client takes their medications for whatever disease they are diagnosed with. You want to still recommend regular diagnostic screenings, exams, but again, this is just to make sure that the disease has not progressed further. And If they have gotten hurt at work for some reason, you want to encourage modified work for those that are injured, especially those that have had a back injury or have broken a bone while on the job. You don't want them to do the same level of work that they were doing. You want to reduce or modify that work. And then we have tertiary prevention, and this is more so the focus of managing long-term problems. This is people with cancer, chronic musculoskeletal pain, people with heart disease or diabetes. So the disease has progressed, but you want to hopefully help increase the quality or maximize the quality of life. So you may want to encourage a rehabilitation program, and you can do this with stroke patients, cardiac patients, diabetes patients. You want to encourage going to pain management programs or even support groups. So again, when we talk about primary, tertiary, secondary prevention, primary focuses on not developing the disease. Secondary, the disease is already there and you're just managing those symptoms. And then tertiary, if it's lifelong or long term, you want to help maximize the quality of life in the presence of that disease process. So when we talk about disease prevention, you want to focus on primary prevention while you're in the healthcare field. But again, sometimes this is not possible and you still want to help encourage through whichever disease process and state that they're in. Here's a segue into the stages of the research process. When we talk about disease development and pathophysiology, a lot of times we want to help with the prevention of disease. And we have a process that helps us develop new medicines and technology that will help us not only identify the disease process early, but hopefully will help us develop methods to help prevent future cases. So this is just a process by which research happens. In stage one, you have basic science, you have technology, you have laboratory work and cell and tissue cultures. And again, this is based off of people that already have a disease process. So you're looking to see what exactly happened, the pathophysiology behind it. The second stage involves human subjects. Once they do have a development of, let's say, a new diagnostic test or effective drugs, they have to test them on human subjects. Now, granted, this process is very, very lengthy, and you have to get something called the International Review Board approval or the IRB approval. But once you get all of that involved, you can test on human subjects to an extent. Of course, this is voluntary and they have to sign consent in order for them to become a human subject. So once they go through stage one, you have stage two where you have the human subjects, and then stage three is where those clinical trials actually happen. And again, it's a large number of patients that have the disease or the risk for the disease, and they'll normally do something called a double-blind study to help review whether or not the new product or new technology is effective or not. So again, this is a very short and sweet, simple view of what the research process looks like. This is not necessarily the focus of our course, but do know that there are new developments occurring and they do go through this process in order to hopefully prevent or cure disorders that occur. These are some basic terms that we'll go throughout our course here. We have basic terminology, which involves the gross level or organ and systems level. When we talk about microscopic level, those are the cells. That's actually the smallest level that we'll talk about in terms of pathophysiology. You may hear us talk about biopsies or the removal of small amounts of living tissue. And normally when they do a biopsy, that's to explore and see what's going on with that tissue to hopefully determine what the disease process is and maybe develop treatment or determine a treatment that will best help that disease process. When we talk about autopsy, that is the examination of organs and the body after death. So biopsy is living tissue and the individual is normally living and they're trying to figure out what's going on, whereas an autopsy, the individual has already passed and they're just examining what exactly happened with that individual. Now, when we discuss disease process, it's good to talk about diagnosis versus etiology. When we talk about diagnosis, this involves the evaluation of signs, symptoms, and laboratory tests to get the basic identification of a disease. So again, we are identifying or telling us what is the disease. Whereas etiology talks about what has caused the disease. And there are several different etiologies that you can go through. You can have trauma, you can have burns, environmental factors, metabolic, nutritional issues, degenerative changes, which generally deals with the aging process. It could be different microorganisms, viruses, bacteria, fungi. You can have immunological dysfunction that doesn't allow you to protect yourself against diseases. It could be inherited or genetic disorders or even congenital defects. Regardless, these are all considered causative factors of a disease process, and some of them can happen in tandem with each other. Again, there are different types of etiologies. I discuss where those areas can come from, but we do have some generalized terms when it comes to etiology. The first one I will talk about is idiopathic. And when we talk about an idiopathic etiology, that means that we do not know the cause of the disease. It could be various factors, it could be no factors at all. It's unable to be determined. So when we talk about idiopathic, that means that the cause of the disease is unknown. Versus iatrogenic, where this is treatment procedural error in the medical field that may have caused the disease. So this can be like a healthcare associated infection. So if an individual develops a CLABSI, for example, that's a central line associated bacterial infection, right? So if the bacterial infection came from inappropriate sterile procedure, that would be a procedure that was erroneously performed, and they introduced infection into the bloodstream, causing the CLABSI or the septic disease. So in this case, we will call that iatrogenic. We also have predisposing factors. I talked about a lot of them on the last slide, but the ones that I want to focus on is age, gender, inherited factors, and or the environment. So just make sure you familiarize yourself between the differences between idiopathic and iatrogenic. Again, idiopathic, we do not know the cause, whereas iatrogenic, more oftentimes that is the procedure, treatment, or a medical error that has caused a disease. Now we're going to discuss the different characteristics of a disease. The first term we'll discuss is the pathogenesis, and this is the development of the disease. Now, this is different from etiology. Etiology talks about what triggered or caused the disease, and again, that can either be idiopathic, it can have a lot to do with different associated factors, or it can be iatrogenic, and we know that there was a known treatment or medical error that was performed that caused the etiology or the beginning of the disease. When we talk about pathogenesis, this is more of a term discussing the progression of the disease or the development. So when we talk about pathogenesis, we're not only talking about what triggered it, but now how is it developing into what we know as that disease process. Next term we'll talk about is the onset. So you have acute onset or sudden onset, and you have insidious onset or gradual. Now this is a little bit different from chronic, and we'll discuss why in a minute. But acute, again, is a sudden onset, whereas you can have an insidious onset where it's you gradually start seeing the signs and symptoms of the disease. Now, when we talk about acute diseases, again, they are short term and they develop quickly. A lot of times they're associated with severe pain, high fevers. When it's acute, everything happens all of a sudden. It's one day you're not sick and the next day you are. It's that sudden. Whereas chronic diseases, they do develop gradually, but what makes it chronic is that you have intermittent episodes. So you have these reappearance of acute episodes. So when we talk about insidious, this is not the same thing as chronic. Although you do have gradual symptoms developing, chronic diseases are characterized by episodes that are intermittent. They come and they go. We have the subclinical state of disease where You have pathological changes, so we don't necessarily see the manifestations or we don't see what's happening. It's just that the subclinical state involves that something has changed. Whereas the latent state, you don't have any signs and symptoms, and it's more so incubation. When we talk about infectious diseases, this is in tandem with the incubation period. Next, we have the prodromal period, and this is the early development of disease. And what I like to talk about prodromal is that it is non-specific signs and symptoms. So you can have a fever. Well, that doesn't necessarily mean you have one disease versus another. We just know that you're sick because you have a fever. Fevers are non-specific signs and symptoms, or maybe even malaise. Malaise is a generalized feeling of weakness. That doesn't necessarily tell us what type of disease that you have. It just tells us that you have something going on. So again, prodromal is non-specific signs and symptoms. Then we'll get into the manifestations. And again, we see clinical signs and symptoms. It can be localized at the site of the problem, or you can have systemic indications of illness, but the manifestations are more specific when we talk about these areas. So again, prodromal, non-specific. When we have actual manifestations, these are specific signs and symptoms. So other characteristics of disease, I talked a lot about signs and symptoms, but what exactly does that mean? When we talk about signs, signs are things that we observe as the clinician or the nurse. So these are objective findings, or otherwise known as our physical assessment findings. And these are our abnormalities that would be the indicator of disease. For example, if I'm assessing someone's lung sounds, normal lung sounds are clear, but if I'm assessing them and I hear crackles, this would be an objective piece of my physical assessment, and it can indicate some sort of disease because crackles are not a normal part of the lung assessment. Then we have symptoms. So symptoms are based off of the client's report regarding the disease process. So this is a subjective area. So they tell me, hey, I'm feeling short of breath, or I'm experiencing some shortness of breath. The client has told me that they are experiencing shortness of breath, so I would write that down as a symptom. A sign, again, is me assessing them and I hear that they have crackles. Their symptom is that they state that they're short of breath. So that's a little bit different. Now, as the clinician, you can also observe shortness of breath, but if the client does not report it and you observe it, that makes it a sign, and we call that dyspnea. Whereas again, once the client reports it, then that's where it becomes a symptom. So there's a little bit of variance there. Now we have lesions, which indicates a localized change in the tissues. We have syndromes, which indicates a collection of signs and symptoms, or a collection of objective and subjective reports that are characterized by a certain disease process. We have different diagnostic tests, and this includes imaging and laboratory tests to help rule out disease process, or it helps to confirm different disease processes depending on what it is. And again, we do different diagnostic tests appropriate to the manifestations and according to the medical history provided. When we talk about remissions versus exacerbations, remissions means that the manifestations have subsided. We don't have any issues with them at this point. Whereas an exacerbation, those same manifestations, they're either present or worsening in their severity. When we talk about precipitating factors, these are conditions that trigger acute episodes. And then we have complications, which are new secondary problems that were not present at the initiation of this disease process. When we talk about therapy, this is a measure to help promote recovery, and sometimes therapy is slow in progress. An example of this would be individuals that have a stroke. If they're at the state that they can be rehabilitated, sometimes physical therapy, occupational therapy, speech therapy, all these modalities can be slow for recovery, but with progression and consistency, you do see progress. But again, this can be slow. Sequelae, are potential unwanted outcomes. And again, these are potential. It's not necessarily our side effects yet, but they're potential, so they can develop. And we have convalescence, where once the disease process happens, we're at the point of recovery and returning to a healthy state. So we have gone through all of these areas in disease, and then now we are here at the state that we have recovered. So we call that period the convalescence period. So, in the world today, we have things called communicable diseases, and these are infectious diseases that can spread from one person to another. It's important to note that these diseases, or some diseases, are reportable diseases, or diseases that should be notifiable. And again, this is because they're doing a lot of tracking with these diseases. So again, it must be reported to the physician or maybe the healthcare authority, and it does vary with local jurisdiction. So the way that we report in South Carolina may be a little bit different from the way that Florida reports, or Minnesota, different areas like that. But you must follow the state laws when it comes to reporting different diseases. Um, the diseases must be reported because they're doing tracking. Again, this has a lot to do with how fast a disease is spreading. So the more that you report a disease, the more that they can track it, and hopefully maybe curb if it's localized to a certain area. So one of the areas that they look at with this tracking that's reported is the incidence. So incidences are the number of new cases within a population within a given time period. So you can have an incidence of flu cases that happen within, or what we call the flu season, right? So this is the number of new cases, whereas prevalence is the number of new, old, or existing cases. So that's different. Prevalence is different from incidences in that you have everything counted as within the whole of this particular statistic. So when we talk about prevalence, that counts new, old, and existing, whereas incidences, it only determines the new amount of cases. When we talk about incidence, by the way, incidence helps us know how fast a disease process is spreading, and it also lets us know if it's within a given population or not. So that way we can better treat, we can better prepare. We'll know kind of where to send supplies to, even if it's in specific areas. So looking at incidences are very important because it again tells us how fast things are going. Prevalence, again, it's a good number to know because within that certain time period, we kind of know how the diseases spike. When we talk about prevalence and incidences, that kind of leads us to the conversation of the demics, or what I like to call epidemics and pandemics. So when we talk about epidemic, this is a higher number of expected cases that occur within the area. So again, this epidemic area, it looks at the number of incidences that occur within a time frame. So if we see a higher number of cases than expected, then we know that the incidence has increased, and therefore we may have an epidemic. And again, this is more so in one specific area. When we start talking about this happening, or a higher number of expected cases happening in different areas around the globe, then we start talking about pandemic. And we just went through a global pandemic such as COVID-19. So that incidence was spreading, and we had higher rates of a new virus that nobody knew anything about, and the incidences of this was spreading across different areas of the globe. And we saw that even here within the United States, when it got here, you saw this influx of disease for COVID-19. So again, once it starts hitting different areas within the globe, you start calling that a pandemic. If it's just localized to one area, we just call that an epidemic. But both of these areas look at the incidences, or the number of new cases within a population within a given period. Okay, that is the end of our introduction to pathophysiology. This was just a basic overview of some of the terms, things that you will see in pathophysiology. The next few chapters, or the next chapters that we go through, will be more specific to a different subject and area of the body. So I'm looking forward to doing that with you. Just make sure you review your chapters as you're studying, do your guided learning questions, make sure you read and do practice questions as available. Thank you, and I'll see you in the next lecture.